So how I came to medical cannabis therapy really was by chance, and as many things in life are serendipitous, this was as well. I was just about to graduate family medicine from the University of Toronto, and I chose a medical cannabis clinic as my last elective, mostly because I wanted something easy before starting my practice. And it was actually the opposite. And when I went to the clinic, my expectations were not the same as what I encountered. It was actually extremely complex, and it was extremely hard. The patients I saw had very significant diseases. There was children with very severe forms of issues, and the medicine we were prescribing was super complex. It was unlike any other medicine, so it actually was extremely challenging. And I remember the very first patient I met was a 5-year-old boy, and I spoke to the parents for about 40 to 50 minutes, and then I learned that their child was on cannabis and that they were using it to treat seizures. And for me, I was just about to graduate medicine. You know, the expectation was that I knew as much as I could. And at that moment, I had an eye-opening experience. I realized I knew nothing, and like I still had so much more to learn. I didn't know cannabis was a medicine. I didn't know that there was CBD and THC. And when I found out from that family that CBD was the only thing that helped their child with their seizures, and they had such a hard time accessing it, and there was very few doctors that could help them. But how it made such a tremendous difference in that child's life, making him a normal kid again, and essentially curing him almost of his epilepsy. I knew at that point in time that patients needed help, and they needed somebody with credibility, and they needed somebody to do the research and help them navigate accessing cannabis. And so I decided kind of right then and there, I went home that night, spent a lot of time thinking about it, and said I'm going to dedicate part of my career to becoming an expert at this, ultimately to help patients.